Millions of people over 60 are having a drink right before bed every single night, thinking it helps them relax, thinking it helps them sleep better, thinking it is harmless, and that drink is slowly, silently destroying their kidneys while they sleep. And the worst part is that by the time most people realize their kidneys are damaged, by the time symptoms finally appear, they have already lost more than half of their kidney function. Permanently. Irreversibly. And it all started with a bedtime habit that seemed completely innocent. My name is Dr. James Harlow. I have been practicing general and preventive medicine for over 20 years, and I can tell you without exaggeration that kidney disease is one of the most underdiagnosed, underdiscussed, and tragically preventable conditions I see in my practice. And what I'm about to share with you today is something that most doctors simply do not have time to explain in a standard appointment. But after seeing patient after patient come into my office with declining kidney function, after reviewing blood work that shows damage that could have been avoided, after having conversations with people who are devastated to learn they are now facing dialysis or transplant, I knew I had to make this video. Let me tell you about a patient I saw just 2 months ago. His name was George, 71 years old, retired postal worker. Came to see me for his annual physical. Nice guy, active, walked every morning, ate relatively well, no major health complaints. When I ran his routine blood work, something jumped out at me immediately. His creatinine level, which is one of the key markers we use to assess kidney function, had increased significantly from his test the year before. His estimated glomerular filtration rate, which tells us how well the kidneys are filtering waste from the blood, had dropped into the range that indicates stage 3 kidney disease. George was shocked. He said he felt fine. He had no symptoms. No swelling, no changes in urination, no fatigue, nothing that would have made him think something was wrong. But his kidneys were failing. And when I sat down with him and went through his daily habits in detail, when I asked him about everything he ate and drank, one thing stood out immediately. Every single night before bed, George had a nightcap, 2 fingers of whiskey, sometimes bourbon. He had been doing this for over 30 years. It helped him unwind, he said. It helped him sleep. And that nightly drink, that seemingly harmless ritual that George thought was helping him, had been slowly destroying his kidneys for decades. And he had absolutely no idea. So let me be very direct with you right now. The bedtime drink I am warning you about, the drink that is damaging kidneys in millions of people over 60 while they sleep, is alcohol. Any alcohol. Wine, beer, liquor, it does not matter. If you are drinking alcohol before bed on a regular basis, especially if you are over the age of 60, you are putting your kidneys under enormous stress at the exact time when they should be resting and regenerating. And the damage is cumulative. It builds silently, invisibly, year after year, until one day your doctor tells you that your kidney function is severely compromised, and there is nothing that can be done to reverse it. Now, if you are someone who has a glass of wine before bed, or a nightcap to help you sleep, and you had no idea this was harming your kidneys, I want you to write the word stopping in the comments right now. And if this is the first time you are hearing that alcohol before bed specifically damages your kidneys, write learning below. I read every single comment, and I want to understand how many people are dealing with this so I can make more content that helps you protect your kidney health. And while you are down there, please make sure you are subscribed to this channel and that you have liked this video, because this information could genuinely save your kidneys. And the only way it reaches more people is if you help me spread it. Let me explain what happens inside your body when you drink alcohol before bed. Because once you understand the physiology, once you see exactly what alcohol does to your kidneys during those nighttime hours, you will never look at that bedtime drink the same way again. Your kidneys are 2 fist-sized organs located on either side of your spine, just below your ribcage. And their job is absolutely critical. They filter your entire blood supply approximately 40 times every single day. They remove waste products, excess fluid, toxins, everything your body does not need. They regulate your electrolyte balance, your blood pressure, your red blood cell production. When your kidneys fail, every system in your body is affected. You cannot survive without kidney function. Now, when you drink alcohol, your kidneys have to process it. Alcohol is a toxin. Your liver breaks down most of it, but your kidneys have to filter the byproducts out of your blood. This puts immediate stress on your kidneys. But here is where it gets particularly dangerous when you drink alcohol at night, right before bed. Alcohol is a diuretic. It makes you urinate more. It does this by suppressing a hormone called antidiuretic hormone, or vasopressin, which normally tells your kidneys to reabsorb water and concentrate your urine. When you drink alcohol, especially in the evening, your body produces less of this hormone. Your kidneys do not reabsorb water the way they should. You lose more fluid than normal. You wake up in the middle of the night to urinate, sometimes multiple times, and by morning you are dehydrated. Dehydration is incredibly hard on your kidneys. When you are dehydrated, your blood becomes thicker, more concentrated. Your kidneys have to work much harder to filter that thick blood. The tiny filtering units in your kidneys, called nephrons, are under enormous strain. Blood flow to the kidneys decreases. Oxygen delivery decreases. And when kidney tissue does not get enough oxygen, cells start to die. This is called ischemic damage, and it is permanent. But that is just the beginning. Alcohol also causes inflammation throughout your entire body, including in your kidneys. Chronic inflammation damages the delicate structures inside the nephrons. It causes scarring. It reduces the kidney's ability to filter effectively. And inflammation also damages the blood vessels that supply the kidneys. These are small, delicate arteries, and when they become inflamed and narrowed from years of alcohol exposure, less blood reaches the kidney tissue. Less blood means less oxygen, and again, we are back to permanent cell damage. Now, here is something most people do not realize. Your kidneys do a significant amount of their repair and regeneration work while you sleep. During deep sleep, when your body is at rest, when your blood pressure is naturally lower, your kidneys have the opportunity to recover from the stress of the day. They repair damaged cells. They clear out accumulated waste. They reset their filtering capacity for the next day. But when you drink alcohol before bed, you completely disrupt this process. Alcohol fragments your sleep. It might help you fall asleep initially, but it prevents you from reaching deep, restorative sleep stages. Your sleep is lighter, more disrupted. You wake up multiple times, and during those fragmented sleep hours, your kidneys are not resting. They are working overtime trying to process the alcohol and its toxic byproducts. They are struggling with dehydration. They are dealing with inflammation, and they never get the recovery time they desperately need. I had a patient, a woman in her late 60s named Carol, who came to see me complaining of chronic fatigue and swelling in her ankles. She said she had been feeling progressively more tired over the past 2 years. She thought it was just aging. Her previous doctor had told her she needed to exercise more, lose a little weight. But when I examined her and ran comprehensive blood work, I found that her kidney function was severely impaired. She was in stage 4 kidney disease, one step away from needing dialysis. Carol could not understand how this had happened. She did not have diabetes. Her blood pressure was only slightly elevated. She did not have any of the typical risk factors for kidney disease. But when I asked about her drinking habits, she admitted that she had been having 2 glasses of wine every night before bed for the past 15 years. She said it was her way of de-stressing after raising 4 kids and working full-time. She said everyone told her that red wine was good for your heart, so she thought she was doing something healthy. What Carol did not know, what nobody had ever explained to her, was that those 2 glasses of wine every single night were delivering a toxic load to her kidneys that they simply could not handle long-term. And because she was drinking right before bed, her kidneys never had a chance to recover. 15 years of nightly alcohol exposure, 15 years of dehydration during sleep, 15 years of inflammation and reduced blood flow had destroyed more than 70% of her kidney function. And there was nothing I could do to bring it back. The conversation I had with Carol that day was one of the hardest conversations I have ever had with a patient. She cried. She was angry at herself. She kept saying if only someone had told her, if only she had known, she would have stopped years ago. And that is exactly why I am making this video. Because Carol is not unique. I see patients like her every single week. People who thought they were fine. People who thought a drink or 2 before bed was harmless. People who are now facing a future of dialysis, transplantless, dramatically reduced quality of life, all because of a habit they thought was helping them relax. Now, let me talk about something else that makes nighttime alcohol consumption particularly dangerous for your kidneys, especially after the age of 60. As you age, your kidney function naturally declines. By the time you are 70, you have lost approximately 30 to 40% of the kidney function you had at age 20. This is normal aging. Your nephrons decrease in number. The ones that remain do not work as efficiently. Blood flow to the kidneys decreases. This is why older adults are more susceptible to kidney damage from medications, dehydration, infections, anything that stresses the kidneys. When you add alcohol to this picture, when you are regularly drinking before bed while your kidneys are already functioning at reduced capacity from normal aging, you are accelerating the decline dramatically. You are taking kidneys that are already vulnerable and putting them under stress that they simply cannot handle. And because kidney disease is silent, because you do not feel it happening, because there are no symptoms until the damage is severe, Most people do not realize what is happening until it is too late. Let me explain what I mean by silent. Your kidneys have an enormous reserve capacity. You can lose up to 50% of your kidney function and still have normal blood tests. You can lose 60 to 70% and still feel completely fine. No symptoms. No warning signs. It is only when you have lost 70 to 80% of your kidney function that symptoms finally appear. Fatigue, swelling, changes in urination, nausea, loss of appetite, confusion. By the time you have symptoms, you are in advanced kidney disease. And at that point, the only options are dialysis or transplant. This is why I am begging you, pleading with you, to take this seriously even if you feel fine right now. Even if your last blood test was normal. Even if you have been drinking before bed for years and nothing bad has happened yet. The damage is cumulative. It is happening whether you feel it or not. And once you cross that threshold, once you lose enough kidney function that it becomes symptomatic, there is no going back. Now I know some of you are thinking, Dr. Harlow, what about the studies that say moderate alcohol consumption is good for your heart? What about red wine and the Mediterranean diet? And those are fair questions. But here's the reality. The research on alcohol and health is extremely nuanced, and most of the supposed benefits apply to very specific populations, very specific amounts, and very specific patterns of consumption. And even in those studies, the benefits are marginal at best and are completely outweighed by the risks, especially for people over 60. More importantly, those studies are not looking specifically at kidney health. They are looking at cardiovascular outcomes. And what the research clearly shows is that alcohol, even in moderate amounts, is harmful to your kidneys. There is no safe level of alcohol consumption when it comes to kidney health. None. Every drink you have requires your kidneys to process it, causes inflammation, causes dehydration, disrupts your sleep, and contributes to cumulative damage over time. Drinking before bed is the worst possible timing. If you are going to drink alcohol, if you choose to drink occasionally despite the risks, the absolute worst thing you can do is drink it right before you go to sleep. You are taking the hours when your body should be resting and recovering, and turning them into hours of toxic stress and dehydration. Let me tell you about one more patient, because this story illustrates how insidious this problem is. His name was Thomas, 67 years old, retired engineer, very health conscious, did not smoke, exercised regularly, ate a clean diet. But every night he had one beer, just one. He thought that was moderate. He thought that was safe. And for years his annual blood test showed normal kidney function. But last year Thomas developed a urinary tract infection. Common problem, especially in older men. We treated it with antibiotics. But after the infection cleared, his kidney function did not bounce back the way it should have. His creatinine stayed elevated. His filtration rate stayed low. And when we did further testing, we discovered that his kidneys had significant underlying damage. The infection had simply unmasked damage that was already there. When I reviewed Thomas's history in detail, when I really dug into his habits, the only risk factor I could find was that one beer every night before bed. And when I explained to him how even one drink, consumed every single night for decades, could cause cumulative kidney damage, he was stunned. He thought one beer was nothing. He thought the guidelines about moderate drinking meant he was in the clear. But those guidelines do not account for the specific vulnerability of aging kidneys. They do not account for the additional stress of nighttime consumption. And they certainly do not account for the fact that kidney damage is cumulative and irreversible. So what do I want you to do with this information? First, if you are currently drinking alcohol before bed on a regular basis, I want you to stop. Today, tonight, do not have that nightcap. Do not have that glass of wine with dinner, and then another one before bed. Do not tell yourself that you will cut back gradually. Your kidneys need you to stop now. If you are using alcohol to help you sleep, I need you to understand that alcohol does not actually help you sleep. It sedates you. It knocks you out, but it does not give you restorative sleep. It fragments your sleep architecture. It reduces REM sleep and deep sleep. It makes you wake up feeling unrefreshed. And it creates a cycle of dependence where you think you needed to fall asleep, when in reality, it is the alcohol that is disrupting your sleep in the first place. There are far better ways to improve your sleep that do not damage your kidneys. Establish a consistent bedtime routine. Keep your bedroom cool and dark. Avoid screens for an hour before bed. Practice relaxation techniques like deep breathing or progressive muscle relaxation. If you have chronic insomnia, talk to your doctor about cognitive behavioral therapy for insomnia, which is far more effective long-term than alcohol or even sleeping pills.
We've been monitoring this
Second, get your kidney
marker,
function checked.
and
If you have
unfortunately,
been drinking
the levels have
regularly
risen
before bed for
sharply in the
years,
last
if you
month.
are over 60, if you have any other risk factors like high blood pressure or diabetes, You need to know where your kidney function stands right now. Ask your doctor for a comprehensive metabolic panel that includes creatinine, blood urea nitrogen, and an estimated glomerular filtration rate. These are standard tests. They are covered by insurance, and they will tell you how well your kidneys are working. If the tests show any decline in kidney function, take it seriously. Even if your doctor says it is borderline or just slightly elevated, that is a warning sign. Your body is trying to tell you something. Do not ignore it. Make changes now before the damage becomes severe. Third, protect your kidneys in every other way you can. Stay hydrated throughout the day. Drink water. Not soda, not juice, not energy drinks. Plain water. Your kidneys need adequate hydration to function properly. Limit your salt intake because excess sodium raises your blood pressure and forces your kidneys to work harder. Control your blood sugar if you are diabetic or pre-diabetic, because high blood sugar is one of the leading causes of kidney damage. Monitor your blood pressure and keep it in a healthy range because high blood pressure damages the delicate blood vessels in your kidneys. And be very careful with medications. Many over-the-counter pain relievers, especially non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can damage your kidneys if used regularly, especially in combination with alcohol. If you need pain relief, talk to your doctor about kidney-safe alternatives. Do not just assume that because something is available over the counter, it is safe for your kidneys. Now, I want to address something that I know is on some of your minds. Some of you are thinking, Dr. Harlow, I am in my 70s. I have been drinking before bed my whole life. What is the point of stopping now? And I understand that feeling. I really do. But here is the truth. Even if you already have some kidney damage, even if you have already lost some function, stopping alcohol now will prevent further damage. It will give your remaining kidney function the best possible chance to stabilize. And it will improve your overall health, your sleep quality, your energy levels, your cognitive function in ways that you will notice within weeks. Your kidneys are incredibly resilient organs. They want to heal. They want to recover. But they need you to stop poisoning them every single night. They need you to give them the rest and the hydration and the support they need to do their job. And in return, they will continue to filter your blood, regulate your blood pressure, balance your electrolytes, keep you alive. But you have to meet them halfway. I truly hope this information changes the way you think about that bedtime drink. I hope it makes you realize that the short-term relaxation or sleep aid you think you are getting is not worth the long-term, irreversible damage you are causing to organs that you absolutely cannot live without. Your kidneys are silent. They do not complain. They do not give you early warnings, but they are keeping you alive every single second of every single day. And they deserve to be protected. So here's what I need from you before you go. I need you to like this video right now. I need you to subscribe to this channel because I make videos like this every single week. Videos that cover the health information your doctor does not have time to explain. Information that can genuinely change your health trajectory. And I need you to leave me a comment. Tell me if you have been drinking before bed. Tell me if you are going to stop. Tell me what other kidney health topics you want me to cover. Your engagement helps this message reach more people who need to hear it. I truly hope this information helps you take better care of yourself and the people you love. Protecting your kidneys is not about fear. It is about understanding how precious and vulnerable these organs are and making choices that support them instead of destroying them. You deserve to live well. You deserve to keep your kidney function. You deserve to avoid dialysis and transplants and all the suffering that comes with kidney failure. And it starts with what you choose not to drink tonight. Take care of yourself. Respect your kidneys, and I will see you in the next video.